Hello everyone, hope you guys are having a wonderful Thursday. This is Dr. Sulochana Gurung today with another episode of To Talk Thursday. I am so excited to be here. So guess where I am today, and ta-da! We are in our office again, and this is our operatory where we will be seeing our patients. And I just have to share good news that we just passed our electrical inspection this afternoon. So yay! Another step towards the opening our office. So yes, thanks for all your support and support throughout, and yeah, and thanks for watching us today. So if you guys are watching me, if you guys can type in where you guys are watching me from, and I can say hi. So yeah, and talking a little bit about our practice, we are a brand new dental office here in the heart of Queens, New York, and opening our doors soon this November 2020, and I cannot wait to meet you all. We are located in 8710 Northern Boulevard, Suite 204, Jackson Heights, Queens, New York. And yes, so that's a little bit about our practice, and again, we cannot wait to open our doors to meet you all. So yeah, stay tuned for more updates. The topic that we are discussing today is dental sealants. So yeah, you all must be wondering what dental sealants are. So I am here today answering the question for you all. And again, if you guys have any questions, you can comment, you can write at the comment section below, and I can answer those for you as they come. Right, so what are dental sealants, right? So let me talk a little bit about the anatomy of the teeth. So as you all can just run your tongue around your teeth, right? So you can feel all those roughness, some elevations, depressions. So anatomically, those are like natural variation of your normal anatomy of your teeth. So some they have elevation, those are called cusps, depressions, like pits and fissures, and the little grooves. So what happens is some people have deeper grooves, some have deep pits and fissures. So so this is the one I'm talking about, a little roughness, a little depression. So it's normal to get those. So what sealants are is, as the word comes, it is derived from the word seal. So what sealants are is something to seal these depressions and deep pits and fissures. So it's like a preventative measure for the teeth to seal the teeth. That way it doesn't get in contact with the acid producing bacteria in the mouth, or the acid attack that is caused by, again, those acidic drinks or acidic environment in the mouth. So sealants are a preventative measure to keep your teeth or your mouth healthy. So let me share how sealants are done. So sealants are, it's a very simple procedure. You just have to, so what we do is we shampoo the tooth, that we just try to clean those debris, any kind of particle that's left in those deep pits and fissures, clean those out, flush it with some water, put a little bonding agent, a layer of paint on top that will hold the sealant on one end and the teeth on the other side. So it's like a little bond that can stick the sealant and the tooth together. So that way it can be held together. So once a bond is applied, we put a little coating, a little layer of sealant on top, on the sides, on those deep pits and fissures. That way, and then zap it with some light, and that's it. Pretty much it. It's so simple. So roughly it takes about 2 to 3 minutes to put sealant on one tooth. So yeah, it's a very simple procedure. And let me talk a little bit about the advantages of sealants. So first of all, sealants are, like I mentioned, it's a very simple procedure. So it takes roughly about 2 to 3 minutes to seal one tooth, and it's less invasive, as like example, like if you're getting fillings done, you have to numb it up. You'll be like numb for about like half an hour to or like maybe 2 hours, and sealant doesn't involve any kind of like drilling or nothing invasive, so it's very simple and it's the best preventative measure. The other thing is there are a variety of sealants available in the market, or we'll have that in our office. So some are like pink color, some are fluoride releasing, some are just transparent. So each one have their own advantage. So if you put the transparent one on, we can see what's going on underneath the teeth. So that's one advantage. The other one is like for the fluoride releasing sealants. That's, I think I like them the best, because what it does is it tends to absorb the fluoride that we take in the form of toothpaste, in form of food or drink, and slowly releases in your mouth. So what happens is that way your mouth, the mouth it keeps the pH. That's the mouth. It creates an alkaline environment in the mouth. That way it fights the acid attack and tend to make it in a neutral environment. So that way less acid attack happens in the mouth, and eventually leading to less cavities. The other advantage is, like I told you, so it just seals the tooth from every aspect. So that way, there's no contact with the food particles, or it it can once it's like in the mouth, once the teeth the food particle, it gets stuck in the tooth. It doesn't anymore because of the smoother surface it creates. So it's very easy to brush it, and you can just clean your teeth by rinsing. So that's another advantage. That's the third advantage. And last advantage is the cost. So it doesn't sealant are it's comparatively cheaper compared to the other kind of restorations that we do in the mouth. So it's cost efficient and it lasts a very long time. And in the event if it chips or cracks, it's very simple. You don't have to get a whole lot of anesthesia or filling again. It's a simple one. You can just smooth it a little and then seal it from the top, or just repair it. So that's something that can be done too. So yeah, here are the advantages of sealants. The other thing is, so who gets the sealants? So I would recommend sealant to any teeth with the deep pits and fissures that are more likely to catch, catch food, or in the event of if you take sticky food, So those individuals, I would probably plan sealant. And in patients with high risk cavity or high risk caries, if you are an individual who has a tendency of getting cavities or caries, it's a good idea to seal those teeth with fluoride releasing sealants. It doesn't matter what age you are, what's your age. I think I would recommend sealant to the population with a higher risk of caries, deep pits and fissures, or young adults where the first molars, you have, so those erupt at around age 6 to 7. So because they are so young and they have to last a lifetime, they have to last so many years in their life. So it's a good idea to seal them as soon as they erupt in the mouth. And and the second molars, premolars, and of course the baby molars, because again, they erupt around 2 to 3 years of age, so they have to serve you for the next 10 to 12 years. So it's a great idea to seal them as well. So yeah, these are some of the recommendations of sealants and advantages and how it's done. Again, if you have any questions, you can always write them at the comment section below. And yes, and if you have any suggestion, or if you'd like me to talk about any topics, you're all welcome to, write me, okay? Write to me, okay? All right, so this is all for today, and I will get back to you sometime next week and give you guys a tour of the office. Yeah, take care. Bye-bye.